Hyperthermia means a body temperature that is above normal. It usually is thought of as heat illness or heat stroke, but it can also mean heat treatment, the carefully controlled use of heat for medical purposes. Today, I will talk to you about heat being used in the treatment of cancer. When our body cells are exposed to higher than normal temperatures, changes take place in our cells, and these changes make the cells more affected by radiation therapy and chemotherapy. Very high temperatures can kill cancer cells outright, but they can also kill the healthy cells and tissue. That is why hyperthermia must be carefully controlled. Using heat to treat cancer has been around for some time, but today, newer tools allow better control and more precise delivery. There are two main ways in which hyperthermia can be used to treat cancer. One is using very high temperatures to destroy a small area of tumor cells. Two is raising the temperature of the body or body parts to a higher level, not to kill the cells directly, but enough so that the other cancer treatments can work better. Local hyperthermia is used on a small area that has the tumor. High temperatures kill the cancer cells. In effect, this cooks the area that is exposed by the heat of radio waves, microwaves, and ultrasound waves. And this heat can be applied externally by pointing high energy waves at the tumor on the body surface using a machine, or internally by placing a needle right into the tumor and heating the tissues around it. Radiofrequency ablation is probably the most commonly used type of local hyperthermia. It uses high energy radio waves in the treatment. A thin, needle-like probe is placed into the tumor for a short time, usually 10 to 30 minutes, and heats between 122 to 212 degrees Fahrenheit. This kills the cancer cells, and it can treat up to a 5-centimeter tumor in the liver, kidney, and lungs. Long-term outcomes are not yet known, but they are encouraging. In regional hyperthermia, a part of the body, such as a limb, organ, or body cavity, is heated. The heat is usually combined with chemotherapy and radiation therapy. Blood from a certain area can be pumped into a heating device, making the blood 104 to 113 degrees Fahrenheit, and then pumped right back in along with the chemotherapy. This is a surgical procedure, and it is used for sarcomas and melanomas. Another type is heating chemotherapy drugs and circulating them through the peritoneal cavity, and is called continuous hyperthermic peritoneal perfusion, or CHPP. It seems helpful, but still not clear if it is any better than the other types of treatments. Another approach to regional hyperthermia is deep tissue hyperthermia. A device is placed on the surface of the organ or body cavity, and high energy waves are directed at a certain area. These devices give off radio frequency or microwave energy to heat the area that is being treated. Now, whole body heating is being studied as a way to make chemotherapy work better on cancer that has spread. Body temperatures can be raised by using warm water blankets, warm water immersion, and thermal chambers, and the patient's temperature would rise to a fever level of about 104 degrees Fahrenheit. A major advantage of regional and whole body hyperthermia is that it seems to make the other forms of cancer treatment work better. A major disadvantage is monitoring the temperature of the site being treated, and careful temperature control is a must. Right now, an MRI is a newer and preferred way to monitor the temperature without putting in probes. The future of hyperthermia is a promising way to improve cancer treatments, but it is largely experimental. There are many clinical trials that are being used to better understand and improve these techniques. Current studies are looking at how it might work to treat different types of cancer, including bladder, cervical, endometrial, pancreatic, and the list goes on and on. I do hope this has helped you to understand a little bit more how hyperthermia can be used in the treatment of cancer. I'm Nurse Peggy, reporting to you from Dreamy Draw.